Hello everyone, I'm Urologist Erdem Akkaya. Today I will talk about microdosing in testosterone replacement therapy, and its advantages and disadvantages. In testosterone deficiency, the patient may have symptoms such as erectile dysfunction, loss of sex drive, low mood and decreased energy. And when we treat the patient, these symptoms disappear and we can protect the patient from cardiovascular diseases and insulin resistance that may occur in the future. There are studies on this subject. It has been shown in many publications that men with low testosterone have increased mortality rates from all causes and are more likely to be affected by cardiovascular diseases. At the same time, it has been shown in publications that the patient can be protected from cardiovascular diseases such as heart attack after low testosterone is treated. A lot of research continues to be done on this subject. How do we perform testosterone therapy? There are modified chemical versions of testosterone called testosterone esters. What is the difference between them? It is the frequency of injections we give to the patient. For example, the first testosterone ester, testosterone propionate, needs to be injected into the patient every 3 days, that is, at frequent intervals. The latest testosterone undecanoate is injected every 3 months. So 4 times a year is enough. But what problems can occur with these? When we inject testosterone ester, testosterone rises rapidly, peaks and the sudden rise can affect other hormones. Can cause symptoms such as a sudden change in mood, flushing, tingling in the hands and arms. But it should not be confused. Coughing fits are also rare in users of anabolic steroids or testosterone, about 1 in 1,000. The reason for this coughing fit is thought to be that the injection is rapidly absorbed from the vein and goes straight to the lung, causing microvascular pulmonary embolization. There are even reports that during this coughing fit the patient can taste a medicinal oil in his mouth. Some patients may experience a drop in blood pressure with a coughing fit. These are very rare, 1 in 1,000 cases. What we are trying to explain is that the patient does not want to use the drug due to a sudden increase in testosterone, and develops resistance to treatment. In such cases, when we cannot give testosterone to the patient, microdosing comes into play. What happens in microdosing is that the patient injects himself with small doses of testosterone under the skin every day. Not intramuscularly, but subcutaneously. Just like insulin injections, he does it every day and after a certain period of time the testosterone remains stable in a narrow band in the blood. This is not exactly physiologic, but it is more physiologic than the previous treatment and it saves the patient from sudden peaks. Thus, the patient responds better to testosterone therapy. This is not a treatment that every patient will accept anyway. Patients who take good care of themselves and are careful can use it. After all, the patient has to inject himself every day. This is the problem with testosterone esters. We can say that it is healthier to do small doses at frequent intervals. But already in 2019, forms that can be used orally in testosterone therapy have been developed. Do not confuse it with Virgin. Virgin is a very old drug, its bioavailability is very low. But these oral testosterone capsules called Jotenza allow the intestines to absorb the drug from the lymphatic circulation of the intestines, saving testosterone from liver elimination and allowing it to pass into the system. This drug can increase testosterone from 150 to 750 during the day, and patients can use it 1 or 2 times a day to bring testosterone to normal levels. They have also introduced applicators like insulin injectors. At the end of the day, testosterone therapy is actually a personalized treatment. The patient's other organ systems, other hormones, the patient's sleep, hygiene, nutrition, micronutrient intake, microbiota, stress, and exercise program are all part of testosterone therapy. All these need to be approached holistically. Sometimes the patient may not benefit from his testosterone despite having high levels of testosterone. They may not benefit due to problems in other organ systems, hormone systems or toxic substances taken into the body in stress. It is absolutely necessary to approach the patient as a whole. You can consult me on WhatsApp about erectile dysfunction, loss of sex drive, or testosterone. Thank you for listening. Best regards.